It was a typical early fall morning in Brown County. Nashville resident Joyce Powell made the short walk from her car to the toy chest where she's worked for over 20 years. It was during that walk that she first noticed something was wrong.
I got this pain in my shoulder when I was walking up here, and I thought, boy, I must have slept on myself crooked. So I came into the store and I went into the office and I thought, I'll take an aspirin and just sit down. So I sat down for about 15 minutes and it went away.
Over the next several days, while keeping to her busy schedule, the pain returned, prompting Joyce to visit her doctor. After an examination, he referred Joyce to Bloomington Hospital's Regional Heart and Vascular Institute for further testing.
I didn't want to accept the fact that I had a heart problem. There was no doubt in my mind that I was perfectly healthy and would pass that stress test.
But Joyce, who has a family history of heart trouble, didn't pass. A heart catheterization was scheduled at Bloomington Hospital's state-of-the-art cath lab to examine Joyce's blood flow to her heart and to test how well her heart was pumping. The catheterization revealed multiple blockages. Joyce was told she would need to have cardiovascular surgery.
He told me then that I had at least a triple blockage, and maybe more, he didn't know. And he would rather I did not come home from the hospital until they did the surgery.
To perform her surgery, Joyce turned to cardiovascular surgeon Dr. Deon Vigilance, who immediately began to work with Joyce to prepare her.
Her blockages were in all three of the major coronary vessels. There are three main vessels that supply the heart, and she had blockage in all three of them. She required 3 bypasses.
The surgeon wanted to do all kinds of tests to be sure I was a good candidate. He wanted to check these arteries, and he wanted to check lots of things, which he did, and that was a reassurance to me that I was in the right place.
Joyce underwent successful surgery and was soon on the road to recovery thanks to the team at Bloomington Hospital. Dr. Vigilance also gives credit to his patient.
Her overall demeanor was excellent. As a patient, she was a role model patient. She was very interested in the process. She had great support from her family, particularly her husband, who was there every day with her throughout this process. And she was very curious about what the next steps will be and willing to do whatever it took to get through the process as quickly and as easy as possible. So she was a great patient.
For Joyce, the care she received at Bloomington Hospital only reaffirmed she made the right choice.
The quality of medical care is right here in this region, because you usually think about going up north someplace or south someplace, but it's right here, and they're so caring. And I don't know if everybody else knows that, but we learned it.
Joyce also credits the extraordinary care she received from Dr. Vigilance before, during, and after her surgery.
But he stayed there. The nurses told me it was marvelous. He was right there in intensive care with me. Said that he refused food, but they gave him something to drink. I think that's a good testimonial for a physician.
Well, I treat my patients as though I would like my family to be treated. I kind of look at it as if I'm going to spend time with someone to do something as invasive as heart surgery. It's a significant investment in their time and significant amount of trust they put in me to take care of them. So I kind of invest my time in them at the same time and really take care of them. So I try to pay particular attention to their needs and make sure that when I leave the hospital, I can go home and sleep because they're safe.
Today, Joyce is back to her normal life and is busier than ever. Her recent experience helps put life into perspective.
It makes me more conscious that I'm not going to live forever. I mean, I knew that before, but now every day is really valuable to me. And when I think that that heart surgeon held my heart in his hand, I can't imagine what a feeling that is for a doctor. And that at the same time, he gave me another day, or 2 days, or a year, or whatever it is. And I'm more appreciative of that. So now I can say, oh, just go to the Bloomington Hospital. That was my right choice.
Bloomington Hospital, advancing medicine, enhancing health.